In the name of God, the most gracious, the most merciful, we welcome you at the third session of the Gulf Studies Forum. The title of this session is as follows: Kuwait's response to Covid-19 and its repercussions. We've got two papers. They shall be delivered by Dr. Fahd Yusuf al-Fadala with his colleague Mohammed Batwaih, and the second paper delivered by Dr. Malak al-Rasheed. The allotted time for each speaker is 20 minutes, and then we shall open the floor for receiving your questions. Dr. Fahd Yusuf al-Fadala is a consultant at the Arab Planning Institute in Kuwait. He was the head of the education department at the Arab Open University in Kuwait. He has published many books, studies and research papers in a number of international and Arab peer-reviewed journals. Most recently, Kuwait's Domestic and Foreign Policy, a reading of the political discourse of the late Emir, His Excellency Sheikh Sabah Al-Ahmed Al-Jabir Al-Sabah. He, along with his colleague Mohammed Batwaih, who is absent today, will be presenting this paper. So Mr. Fahd Yusuf Al-Fadala will be talking to you. It gives me great pleasure to be at the 8th edition of this vital conference that sheds light on current affairs and current events in the Gulf and the Arabian Peninsula. I shall be talking about a subject that has a social dimension. Our session, as my dear Dr. Yacoub has said, shall be tackling the Kuwait's response to COVID-19 pandemic. The title of the paper is being mentioned, and my colleague is Mohammed Batwaih, works with me at the Planning Institute, the Arab Planning Institute in Kuwait. The title of the paper, as I said, is Kuwait's response to COVID-19 and its repercussions. These are the slides, and I'd like to say that this paper is one of the first Arabic papers that tackled the issue of COVID-19. We have started the preparations of this paper in March. Since the beginning of the pandemic, on the 24th of February, we had the first case, or the first three cases coming from Iran. We, as researchers, have monitored the Kuwaiti policies in this domain. We have finalized the paper in July 2020. It took us 4 months of avid observations. So this paper relates to the 4 months that I've talked about, from March until July. Following July, we haven't put into place any observations. I will be talking about the subject following certain components. I'll start with the introduction and the methodology and the general policy of Kuwait in planning and addressing the COVID-19, as well as the executive procedures on the part of the government and the other stakeholders to address the COVID-19 pandemic. We have assessed the procedures, and we came up with a splendid outcome. Kuwait has done greatly in this regard. The death toll was minimal, and the number of cases was limited. The healthcare system has been steadfast, and the cooperation as well as the coordination between the effective stakeholders was splendid, especially the competent governmental authorities as well as the private sector and the civil society organizations and the Kuwaitis and the expatriates. So the outcome has been promising as far as addressing the crisis is concerned. At the beginning of our work, we have put the problem of the paper. What are the general policies of Kuwait to address the COVID-19 pandemic? What we mean by the general policies is the vision of the government, the laws, the bylaws, the procedures, the information, the raising awareness campaigns, and so on and so forth. The government, represented by the cabinet. So, the measures that have been taken by the ministerial cabinet in coordination and cooperation with the supportive elements of the society to stave off this crisis. So, the general policy relates to the governmental agenda. So, this is what we mean by the general policy, the plans, the strategies emanating from the ministerial cabinet, cascading through the Ummah Assembly, and this reflects obviously the approaches taken by the government to solve the problems and face the crises, the political discourse, the effectiveness of the governmental plans during a period that stretches over a year or 4 years or 5 years. So the public policy is the rules, the regulations, the measures that have been taken by the government, especially the ministerial cabinet. So the main question, as I said, is the public policy of the state of Kuwait to face the pandemic. We assessed the aforesaid plans, and as you know, the pandemic is not a health related crisis per se. It is more than that. It is educational, political, economic, social, and so on and so forth. But obviously, the health issue is the prominent issue amongst the aforesaid issues. So, how the political discourse of the decision makers of Kuwait dealt with this pandemic. And we do understand that the public narrative is the governing discourse that might unify or disintegrate in accordance with the measures that are taken by a given state. So the Kuwaiti public discourse by the late Sheikh has been crystal clear when the late Sheikh has said that we are facing a death and life issue, and indeed we have mobilized all the resources, the financial and the human alike, to face this pandemic. So the leader of the Ummah, the late Sheikh Sabah al-Ahmed Sabah, talked to the nation, delivered a speech, and his speech constituted a covenant that the Kuwaitis have abided by. The speech has talked about the pandemic, has talked about its repercussions, implications, and gravity. The political discourse, as I said, took place on the part of the leader of Kuwait, and thus plans were established, strategies were put into place, the ministries worked in unison. Mr. Fahd, sorry for interrupting you. The slides, we can't see the slides. We can see the first one only. Just to match your intervention with the slides, please could you show the slides? Okay, if it's not possible, no problem. So what is the public policy? Second, what was the political discourse? Third, what were the executive measures that have been effective in our community since the beginning of the pandemic, March 2020? And what about the effective forces, the institutions, the agencies, the community-based institutions? As you know, Kuwait has been institutionalized. It is a country that hinges on institutions, the Chamber of Commerce, the Federation of the Kuwaiti writers, and other civil society related organizations. These organizations also played a major role in facing the pandemic. So we have assessed their measures as well. Getting acquainted with the public discourse, understanding the public policy, uh, determining the procedures. We wanted to understand how the ministries acted, and fourth, the extent of the participation of the civil societies organizations. As far as the importance of the paper is concerned, we have uh, shed light on the most prominent political dimensions. We wanted to put a diagnosis of that confrontation and the loopholes, the shortcomings, the errors that have been committed, the response of the Kuwaiti community, the level of satisfaction of the Kuwaiti society as well. In the education domain, the economic, the food security, the social domain, and so on and so forth. So we have scrutinized this very carefully, in addition to different visions that have been portrayed by different organizations. So we wanted for the procedures, the legislations, the bylaws to be sound. Are they satisfactory? Are they sound? Can they be criticized by the citizens, by the press, and so on and so forth? As far as the methodology is concerned, this paper is a qualitative paper, and it is not a quantitative. So we relied on the qualitative approach, whereby resources can be derived from data. So we focus on data, on indicators, on information, This methodology is different than the quantitative methodology that relies on field studies, questionnaires, and so on and so forth. And thus, the focus has been put on the accurate determination of the subject matter and the crystallization of the objectives, and then collecting the information, analyzing them, and then assessing the information to arrive at indicators that can be beneficial in our assessment journey. So, in accordance with the sound vision and the best practices, the assessment of the implications, the repercussions, and then the formation of a scientific-based report to understand the ability of our society to confront the pandemic. So, the upshot was to do with an elaborate report to assess the measures taken in the economic, social, and other domains whereby such outcomes can constitute a tool that can be utilized by the decision makers in the state of Kuwait. In accordance with the questions that I've posed, the first was to do with the public policy on the part of the government and how they dealt with the pandemic. This was the first question, and as I said before, the state of Kuwait has addressed the COVID-19 pandemic in accordance with our assessment. Indeed, the government has addressed the pandemic in a splendid fashion. Why? Because it has focused on the public speech delivered by His Highness the late Emir, whereby this speech represented the fact that we are facing a crisis and we need to be diligent, we need to deploy efforts in order to stave off this crisis. On the 22nd of March, His Highness said that the stakes are high, we are in danger, and thus we need to work in unison to arrive at a good solution. So, the Kuwaiti Ministerial Cabinet, in accordance with the public discourse, has established a working group to confront the pandemic. 16 sub-working groups were established to deal with the economy, education, the community, security, food security, health, and so on and so forth. So, the 16 working groups worked under the umbrella of the main team represented by the ministerial cabinet. So, it was a concerted effort that took place on the part of all the working groups. The state of Kuwait is adept at the technology to some extent, and the working groups indeed were able to unify their efforts online and provide their services to the populace online. Kuwait represents or rather the expatriates represent 70% of the populace, and most of them do not understand Arabic, apart from the Arab expatriates. So this was a challenge to liaise with the Asian community, and those who do not understand Arabic represented a challenge for us. In addition to that, we have monitored the capacity of Kuwait to repatriate its citizens from abroad. 40,000 Kuwaitis have spread over the five continents, and Kuwait perhaps was the only country within a few days. Kuwait was able to repatriate its citizens, and this was impressive. The third question: what are the measures that have been launched or taken in this regard? What was the role, or what were the roles of the 16 working groups that I have mentioned? The fourth question of this study is as follows. The extent of the participation of the Chamber of Commerce, the federations, the different agencies, the civil society organizations in confronting the pandemic. The government on its own couldn't obviously face such pandemic without the participation of all the stakeholders who have worked diligently in coordination with each other. And indeed, these were the organizations that played a major role in meeting the target. The assessment of these organizations has been positive, and the technology in Kuwait has represented a supportive factor. Fifth, what were the packages that were adopted during that period? So, what were the measures taken by the government to address the pandemic and its negative implications? As far as the economy is concerned, the public policy of the government bigoted subsidiary policies and measures to support the Kuwaitis, especially the retired, the pensioners received their salaries online. So the state's intervention has been very positive, especially as far as the pensioners are concerned. It has established the National Fund to confront the Covid-19 pandemic, and this fund has been open for fundraising on the part of the individuals and the institutions alike. It has funded the quarantines, the stranded people, those who wanted to travel abroad. So this national fund to combat COVID-19 pandemic has been established, and it has been indeed a positive step. In addition to that, the support that the support to the SMEs, to the tourist industry has been afoot, in addition to mitigating the losses of the different industries, especially the SMEs. The state of Kuwait has appropriated certain funds to them, and has put into place fiscal policies that were paramount. In addition to that, these institutions were instructed in order to rebalance the demographic loopholes. As far as the social aspect is concerned, following the general policy of the state, the government has provided direct subsidies to the vulnerable groups. It has provided food, to the expatriates, especially those who were stranded in certain areas. On a daily basis, the government has provided food for them, uh, and this obviously is intrinsically linked to the food security element. It has provided subsidies also to the citizens. It has worked on cementing the societal coherence and to mitigate the hate speech against some of the expatriates and to curb the workers in the black market. And Also, the government provided tickets, travel tickets to some. So the government has. Doctor, if you could finalize your intervention, please. As regards the economy, since the start, the government has had a control over the underbellies of the economy. It has shut down the borders as well as stopped the flights as well as it has built the quarantines, hospitals, and it has established health teams, and it has asked from the WHO to send a team to assess its programs. It has also asked Pakistan and Cuba to dispatch doctors to help around and so on and so forth. As far as the education is concerned, and this has represented a great problem, we have focused on the online education. Through the Ministry of Education, we have established TV channels, education related channels, and other measures that have been adopted by the government. We have also enacted a number of laws to underscore the importance of abiding by the laws and so on and so forth. The law enforcement agencies also played a role in cementing the security. And Doctor, I am about to finish. The paper is there. You can consult it. Thank you very much indeed. Thank you, Doctor, for your intervention. And I have a question. Perhaps I'll address it to you later. We'll move to the second paper.
Dear Dr. Malak Rasheed, so her paper is entitled Kuwait's Response to COVID-19 and its Handling of Migrant Labor. Dr. Malak is my sister and my colleague, and also she is Associate Professor of Social Work at Kuwait University and currently visiting professor at Rutgers University in New Jersey, United States. And previously, she worked at the Supreme Council for Family Affairs and headed the Gulf Europe Studies and the Gulf America Studies units. She has published many studies and research papers in international and Arab peer-reviewed journals. Dr. Malak, 20 minutes, please. The floor is yours. Good evening in Doha and the Gulf, and good morning here because it's still 7 a.m. So I say good morning from New Jersey, and I had hoped to be with you, but I couldn't this year. Hopefully next year we'll be able to do so. I would like to thank my brother and my professor uh, for this introduction and for his uh, chairmanship of this session, Dr. Yacoub Al-Kandari, and it is a great pleasure to be here with you. And also, it is great to see the forum tackling the key relevant topics in the Gulf and globally. So, I am participating under the Kuwait's response to COVID-19 and its repercussions, and I will present my paper entitled Kuwait's Response to COVID-19 and its Handling of Migrant Labor. The slides are not changing. Just give me a couple of seconds, please. Yes, we can see it.
آم، بالنسبة حق الموضوعات اللي بتكلم فيها
So I will be
راح
talking
أتكلم في
about,
مقدمة أو توضيح في البداية،
or I
وبعدين
will
راح
start with
أتكلم
an
عن
introduction,
الآثار
and
الاقتصادية
then we'll talk
للجائحة في
about
سوق
the
العمل
economic
وفي الناحية الاقتصادية
repercussions on
بشكل
the
عام.
labor market
وبعدين راح
and
أتطرق
the economy in
في
general,
بعدياتها
and
قضايا
also the
حقوق الإنسان
digital
والقضايا البشرية، وبعدين راح أتكلم
field,
عن
and
المحاور
also
الحياتية
the
والنتائج التواصل
racial
اليومية
affairs,
المصغرة اللي
affairs
نقوم
of
فيها
racism, and
لإنشاء
also
وتنظيم هذا
I will
المجتمع.
be telling you
آه،
about the study that I partook in.
بس سؤال حق المنظمين،
And I have
شلون
a
تصلون
question: how can I
لأن مغطي على الجزء
minimize the
اللي
screen?
في
Okay,
النص
so I,
الفوقاني
I,
بس.
I cannot see the presentation. I need to make it a bit
فاهمين
smaller.
معاي السؤال ولا؟
Is it possible to help me out?
أيوه. أوكي.
Is this better? Yes, okay.
أوكي، بس الحين ما أشوفكم بس أنتم تشوفوني.
So I cannot
طبعا
see you, you
نعيش
can see
عالمنا
me. So,
اليوم ومن بداية عام
uh,
2019 وضع استثنائي
since
بحيث يكون الوضع كثير
2019, we
مستعد
have
لمدى
been
الدول تشكل
through
مجالاتها بسبب
exceptional
تعيش الجائحة،
time,
مو بس لخطورتها
and
على صحة البشر
the
وتهديد
COVID
الحياة،
pandemic spread
لكن لعمق
and
وكمية
not
تبعاتها
only
اللي أدت
threatened
لبناء
the
العالمية
health of
الاستجابة
human
الاقتصادية
beings, but
الاجتماعية النفسية
also
والسياسية.
there were
فرضت
repercussions at the economic,
الإجراء على
social,
جميع
and
دول
political
العالم اتخاذ
level.
مجموعة من الإجراءات
So,
التدابير
this
الاحترازية
pandemic
مثل العزل
imposed a
والحجر الصحي
number
والتباعد
of
الاجتماعي
measures and
ومنع
preventive
وتقييد السفر،
measures like
مما انعكس
isolation,
سلبا على الاقتصاد
quarantine,
العالمي
and
وأصبح يعيش
limiting
في
the
حالة من
movement of the
الركود.
people.
هذا
And
الركود
this
تسبب في
led
ظهور أزمة
to
اقتصادية عالمية غير
recession
متوقعة
in the world,
ضربت الجميع بنفس
and
الحد، حيث
the
عرقلت الإنتاج
unexpected
والإبداع والنقل الجوي عبر العالم،
crisis,
وضعف
economic
الطلب
crisis,
العالمي
hit
مما أصاب
different
قطاعات
countries all over
اقتصادية
the world
عديدة كان
and
أبرزها
affected the
قطاعات النقل
transportation
والطيران والنقل
and the
والسياحة،
banking,
واللي
aviation,
أصابتها
tourism
خسائر
sectors
بشكل
that
فادح.
suffered
بالنسبة
tremendously.
للآثار الاقتصادية
When it
للجائحة في
comes to
مجال
the
سوق العمل،
economic
أعلنت
repercussions
الأمم
on the labor
المتحدة
market, the
أن
United
كوفيد-19
Nations
راح
said
يؤدي
that
لزيادة
COVID
البطالة
19
بشكل
will
كبير في
increase
جميع أنحاء العالم،
unemployment
مما راح
all
يرفع
over the
معدل إلى
world
25
and
مليون
will
شخص
leave
بدون وظائف،
25
وراح
million
يؤدي إلى
people at
انخفاض
least
دخل
jobless
العاملين.
and will
ويشير
also
تقارير
reduce the
البنك
salaries
الدولي
and
إلى
income
أن العقود من
of
التقدم في
uh,
محاربة الفقر
professionals.
كانت
And
جميلة
after
بداية
decades
أول
of
انتكاسة إلى
improvement
الجميع،
when it comes
وقد
to the
أفضت
fight
الجائحة إلى
against
سقوط ما
poverty,
يقارب 8.8
2020
مليون شخص
was
في
a
الفقر
step backward,
المدقع في هذا العام، وأطلق على
and
هؤلاء ما
people
يسمى
are suffering
بالفقراء الجدد.
or
في سيناريو أسوأ
from
الأحوال هذا
poverty.
الرقم
There's
راح
something called new
يرتفع إلى
poor
115 مليون
people,
فقير.
and
كما حذرت
some
دول
projections
الاتجاه
see
الاقتصادي والاجتماعي لدول
115
القاسية الأسوأ
million
من أن
new
كوفيد-19
poor
ممكن
people,
يتسبب بخسارة
and
أكثر
COVID
من
19
1.7
could
مليون
lead
وظيفة
to loss
بس في
of
العالم العربي خلال
1.7 million
2020.
jobs in the Arab world
أزمة
only
الجائحة
in 2020.
مثلت
So,
تحدي واحد
the
بالنسبة للدول
crisis of the
الحديثة
pandemic
كافة عدة
was
أسباب.
a complex
السبب الأول عنصر
challenge for the
المفاجأة،
Gulf,
مثل ما
particularly
تفضل
for
الدكتور
several
ملك قبل
reasons.
شوي
The first one
قال
is the
أن
element of
الحالات
surprise.
البداية
Just
كانت
like
من
Dr.
الحالات
Fahd
اللي جت
said,
من الجمهورية
that the
الإيرانية.
first
عنصر المفاجأة بعد
cases
قام
came
بتطور
from
وتيرة
Iran.
سريعة
So the
لتدمر
of the
بالإضافة
geographic
حتى يوقف
proximity
انتشار
to
الوباء
Iran,
بشكل
which
أسرع.
was one of the
هامش
epicenters of the
الاعتماد نقطة
pandemic in the
الاعتبار
Middle East.
واقتصادات
In
وعائلات
addition to that,
دول الخليج العربي
most of the
على الصناعات
economies of
البحرية، واللي
Arab
كانت واحدة من أشد
countries
الصناعات تأثرا
rely on
نتيجة
oil,
استخدامها بأنشطة
and
العمل والأفراد
oil
والبضائع والسلع
sector
على المستوى
was
العالمي.
one of the sectors
خامس
that
شيء،
were
وهذا
affected the
موضوع
most.
حديثي اليوم،
And
أن دول
the
الخليج
third
لديهم
point
عدد
is that
كبير من
the Gulf
الوطنيين بما
countries
يتجاوز 13
have
مليون عامل
several
من كافة دول العالم،
expats, many
وتشغل
expats,
أين تعتقد
13
سفر
million plus
يوميا
expats
تتضمن
from
انتقال
all over
دولي
the world,
لإرصاد
and
عقارات
they
كاملة
have active movement
والبرية بشكل
and
يومي،
transportation
مما وضعها علينا
through
واتضح
the
الخطر من
airports.
انكشاف
So
انتشار الوباء أن
the
استخدام
Gulf
سفراء
countries
الواحدين لإدخال
were
العديد
stuck
الكبير من قطاعات
between
معرفتها
the
بدون سيما خسائر
trying
اقتصادية
to limit the
جراء
spread of the
توقف
pandemic
جائحة
on the one
كوفيد.
hand, and on the other,
صحيح
the
كانت جديدة،
economic
ولكن لم
losses.
تكن الوباء الوحيد اللي مر في
Of
العالم،
course, the
ولذلك
COVID
هناك
pandemic was new,
قوانين
but it
لحقوق
wasn't
الإنسان
the
دولية
only pandemic. This is why
تنظم
there are
كيفية التعامل مع مثل
international
هذه
human
الجوائح.
rights
من ضمن
laws
القوانين
that
مقتضى
regulate
القانون
this
الدولي لحقوق
aspect.
الإنسان
The
لكل شخص على
human
مستوى
rights,
من
the
الصحة
international
والأبوة، ويلزم
humanitarian law
بهم باتخاذ تدابير
imposes
لمنع
on
تهديد الصحة
countries
العامة
a number of
وحماية الحياة
measures
الصحية
to
للمستهدفين.
stop any
ويقرر،
threat to
وهذا مهم
public
جدا،
health.
أن القيود
And
التي تفرض على
also,
بعض
the law
الحقوق في
stipulates
سياق
that
التهديدات
some
الخطيرة للصحة العامة
restrictions
وحالات
that
الطوارئ
are
المهددة
taken
للحياة
as
اليومية
measures
يمكن تبريرها
to
عندما
protect
يكون لها
during
سقف قانوني
harsh
وعندما يكون
conditions
الغاية
can be
تضمين
justified when they
العادلية
have
ولا
legal
يكون
basis,
تطبيقه بشكل
when they
فردي
are
ولا تمييزي
very
وتؤثر
necessary,
تأثيرات
when
زمنية
they are
محددة على
implemented
أن تحترم
without
كرامة الإنسان
uh,
وتكون قابلة
differentiation
للمغادرة
between
ومتناسبة مع
people,
أهمية تحقيق
and
الأهداف
they need to
المنشودة.
be
وبالتالي لا تعتبر
in line with
COVID-19
the
على مستوى تهديد
objective.
الصحة العامة
So,
تبعا لانتشار محيطا
COVID-19
وخطورته،
was a threat
وبالتالي
to
يمكن أن
public
يبرر فرض بعض
health.
القيود
This is
على
why
الحقوق،
some
مثل
restrictions
بتنظيم أين
could
فرض
be
الحجر
justified,
الصحي أو
such
الحجر
as
لتمنع
quarantine
إغاثة
and
الآخرين
isolation,
التنقل.
in order to limit
منذ
the
تفشي
freedom
فيروس
of movement.
كورونا وفقت
Since
العديد من
the
التقارير
spread
الأخيرة
of
في عدة
COVID-19,
بلدان
several
تحديد
news
العنصرية وقضية
report
التجنب والتمييز
shed
في
light
الأشخاص الذوين
on
بالذات
racism
للحصول على
against
السلبيات. طبعا ما
Asians
أشار إلى
in particular,
منبع أو مكان
and
انتشار الفيروس
this
نقطة انطلاقه في
was
الصين.
because
وطبعا
the
هذا السيطر
epicenter
إعلان ترامب
and the source
اللي
of
أعلنها في أكثر
the
من موقف
virus was China.
أن شك في
And
أن يكون أصل هذا
former
المرض
President Trump
هو
said it
نفاذ بشري،
repeatedly.
وإن قد
So he
يكون
said that
متعمد من
this
قبل
virus
السلطات
could
الصينية
have been
بأشبه ما يكون بالحرب
spread by
البيولوجية.
the
هذه
authorities in China on
الادعاءات
purpose
رفعت
as part
نسبة
of a
التصديق
biological
بشكل
warfare,
كبير،
and
بل
this
كل
has
الأصول
led to an
الآسيوية بالذات
increase of
التي كان عندنا دور
racism and
رصد
racist feelings,
المستجدات
particularly
لدور
towards the
العنصريين
Asian
اللي مشوا لمستوى
nationalities.
ولكن
So,
الصين
from
وكوريا واليابان
China,
يهددون.
Korea,
وبالتالي شنت
particularly.
الحوادث اللي سجلت
So,
في
the
التقارير الإسرائيلية اعتداءات
news
جسدية،
reports
ضرب، تنمر
included
الممارسة
physical
اللاحقة،
assault,
تهديدات غاضبة للرؤساء
threats,
في المظاهرات،
mobs
تمييز فرد
attacking
التعامل
people,
في المدارس والمستشفيات،
discrimination at the level
استغلال
of
لغة
schools,
جارحية في التقارير
and
الإسرائيلية
also
على منصات
using
التواصل
derogatory
الاجتماعي المختلفة.
language on social
نيجي
media
نتكلم عن الحالة
and
الكويتية
the media in general.
ونتائج الدراسة
So
الحالية.
let us talk
بحسب إحدى
about
مركزي
Kuwait.
الإحصاء في
Based
الكويت
on the
بشكل
statistics unit
تقريبي
in
مدة
Kuwait,
إعمار السكان 21
70%
80%
of the
من ذوي
population
الأعمال
is
المتطرفة
made
الانتاجية
of
في الكويت.
expats and
خلال الجائحة
30%
بادر البلاد
national.
أكثر من 150
During
ألف وافد
the
بعد أن أجرى
pandemic,
قرار الإقفال هذه الأعمار
130,000
الشركات
expats had
الخاصة
to
والقوى
leave the
العاملة
country,
خفض الإجبار
especially
بإيقاف
that
تعريف
the
المعيشة
companies
إلى
of the
رواتب
private
بعض
sector
أسر الأعمال الراتبة
were
في الكويت.
affected, and
وتوقف
this
حكومة
has led to
الرئيس السيسي
sacking a
بدءا
number
بعام
of individuals who
2021
had
باستمرار
to
وتيرة
return to
مالية
their
تشير
countries,
الحالة
and the
للرافدة
projections
خلال الفترة
for
المقبلة
2020
بسبب التغيرات المقترحة
and
على
the coming
قانون الإقامة،
period of time
بالإضافة إلى ضغوطات
also take into
متجددة
account a
في سياسات
continuation
حكومة
of
كوفيد.
this trend.
وذكر نفس
And
التقرير بأن نسبة
the report
الوافدين
also
بإجمالي
mentioned
عدد
that
أعداد
the
السكان
ratio
تراجع
of
إلى
expats to
68.7.
or
صحيح
within the
كما تقدم
population
السرية، لكنها
uh,
هي أدنى
it was
مستوى
down
وصلنا
to
خلال السبعة أعوام
68
الماضية. وأشار
percent,
البيانات
point
إلى أن الأعداد الهائلة من
68.7%,
الأعمال
and
الرافدة
the
والدولية والخاصة
expats or
والمنظمات
low-paid
المحلية كانت
jobs
الفئات الأكثر تضررا
were
من تداعيات
the
الجائحة،
most
حيث
affected
أشارت بيانات
by
الهيئة العامة
the
للأمراض الجنين
pandemic.
أن حوالي
In Kuwait, the authorities said that approximately 95% of the expats were unskilled uh, labor labors, and the pandemic shed light once again on the structural problems and increased the burden on the state and made it difficult for the government to contain this crisis, particularly with the presence of laborers, and there was a lot of abuse. And the COVID pandemic, according to some, was considered an opportunity in order to deal with illegal labor in Kuwait and also tackle the lack of proper environment and health measures. And the monitoring efforts led to a determination of the numbers that led to many of them returning to their countries, and this is considered by some people violations of human rights. I will show you some titles or some news titles that were spread on media outlets and also on social media. For instance, Kuwait is facing two pandemics, the hatred of the citizens and corona, kicking Egyptians out of Kuwait. Several titles that increased the feelings of racism, and at least there was a battle of words and sometimes also physical assault. And I will not delve into the numbers a lot. I will be telling you about the results of the study. First of all, the participants were 82, uh, and the biggest percentage was female, and 83% of the participants were Kuwaiti. Most of them had university education level, and you can see the provinces distributed throughout the six provinces of Kuwait. When it comes to the employment, most of them were employed, and few of them were informal daily laborers. When it comes to the financial status during the pandemic, so did it change? Was it worse? Was it better? Most of them said it was unchanged, and some people said 50-50, said better, and the others said worse. So I think that people who said the situation got better benefited from the credit cuts and the postponing of the installment or loan payments. So this also took into account the level of satisfaction when it comes to the measures taken by the government. So the question was, were you affected? Was one of your parents affected, and did you lose any family members? Only 5% of the interviewees lost a beloved person because of COVID, and now we will see the level of trust at a later stage in the government measures. I also asked them, what is the source of your information regarding the government measures in Kuwait? And the answers came the official radio and TV station in Kuwait, most of them, in addition to influencers and social media, and also private channels, in addition to colleagues at work. In addition to that, the first question was regarding the level of satisfaction vis-à-vis the government measures when it comes to migrant workers during pandemic. In general, the percentages between nationals and expats were close, as you can see, and we tried to see whether there was a distinction between nationals and expats. There was no difference, so it was average to low, the level of satisfaction. The same thing applies to the question regarding the trust and the government's measures when it comes to dealing with migrant
بعدين بديت
workers.
أحلل هذه الثقة
So I
والإيمان
tried to analyze this
في
trust
القائد
and this satisfaction. Was it
بالمقابل
affected
راح يبين لنا
by the
اختلاف
demographics?
هذه
And now
المفاهيم
you can see
المختلفة
the following graphs.
يعني تستحق الوقوف
I
عندها
think it is
ولكني
important
راح أكون
to focus
متطرفة
on
حول
these
الذي كان
graphs.
يوجد فوضى
On the
وليس
right,
ثقة
the level of
بالنسبة
satisfaction, on
لمستويات
left,
الرضا
the
أقل نسبة
level
بالرضا
of
هي
trust.
من سكان
So the
محافظة
least
البرلمان
of
لماذا
satisfaction was in Al-Farwaniya province.
سأقول
If you do not understand
من هنا
the
يتم
population of the
التطرف
different
في
provinces in Kuwait,
الواقع
we can say
الديموغرافي
that Al Faraniya is
السياسي
mainly populated by expats. Very few
الحقيقة
Kuwaitis live
محافظة
there.
الفرعونية هي
And also Al
الأكثر
Faraniya
مثل ما يقولون
province
صارفة اللي هو الإجراءات اللي
was
تكلم عنها
affected
دكتور الرشيد
by the
سواء العزل
measures
المنطقي
that
أو
the doctor
إجراءات
mentioned,
الحد من التنقل
meaning
أو
isolation or
العزل
the limiting of
كلها
movement
يعني
and
أكثر المحافظ
quarantine.
شهدت
So
هذه
it
الهجرة
was
هي
the
محافظة
province
الفرعون
that was
فشيء
affected
طبيعي
the
أنه
most.
لما أنت
So it
تقرر
was only normal
الدخول
to
وتأثر
see
على
this result,
جميع
because
الناس
when you
أكيد
limit
راح يكون مستوى
the
الرضا
freedom of
أقل
movement of
وأقل
the people and when you
فالرضا
affect the day-to-day
في
life of the people,
الثقة كان
this would
أقل
be the result.
نسبة ثقة في
As
سكان
to
العاصمة
confidence or
أيضا
trust, it
سكانها
was less
الغالبية
than
أكثر من
the
الكويتيين
people
والغالب
living in the capital
تنافس فيها
city.
مستويات
The capital
اقتصادية
city,
والتعليمية
Kuwait,
والاجتماعية
most of the
ومتوسطة إلى
population
جيدة
is made
عادة
of
هذه تعتبر
citizens
فئات
with high
المجتمع أو
level
الطبقة
of
عادة
education.
تكون
Usually,
من النوع
this is the critical
شديد الوعي
population,
فمن هنا
and
يكون
they
القرار ليقوموا
criticize a lot
بالإجراءات
because they
الاحترازية
read and they always want
يقومون
the measures
بشكل
to be
كبير في
better
البحث
and they
قد يكون
partake
هذا
in
سبب
this.
انخفاض نسبة
So
الثقة في
this is
العاصمة الكبرى
why maybe
بالذات في
the
محافظة
trust
العاصمة
was not that high in the
بالنسبة
government's
لكورونا
measures. When it comes
شيء مو
to the
مفاجئ
experience
بالنسبة
with
لليوسف
COVID,
بأن
it is
من
not a
توفي
surprise
أحد
to
عزيز
see
أو قريب
that
خلال
people who lost a
بسبب
beloved
كورونا
person or a
أكيد كان
family member
أقل مستوى رضا
during the
لأن دائما يكون
pandemic
في اللي هو
were less
اللوم
satisfied
والغضب
because there's always the
كانت
feelings of
الإجراءات بشكل
anger
أفضل
and
كان
blame.
الإسلام لا زال
People
عايش
would say, for
بقوة
instance, had the
وكان نسبة
measures been
الرضا تكون أقل
better,
عند الناس
um,
اللي توفى لها
my
عزيز
family member would
والثقة
have
أو
still
الرضا
been
تكون
with us.
مرتبطة أيضا في ثقة
So the
الإجراءات وكمركز
satisfaction is
سابقة
also
الأولى
linked
هل تم
with the trust in
التعامل
the
مع
measures.
المريض
So
بشكل
was the
صحيح ولا لا
patient dealt
ولا
with
إذا كان فعلا
correctly or
يمكن
not?
التشكك فيما
So
يمكن أن يكون
this is a question
يعني
that
مثل ما
some
يقولون
people
تحاشي
who are
وفاة
skeptical
العزيز
actually could
بالنسبة
ask.
لي مصادر
And
المعلومات
when it comes
المشاركين
to
ووزعها
the
على
sources of the
الرضا
information
والثقة نلحظ
that
بأن
the
أقل
participants
نسبة رضا
use,
هم من
we
الناس اللي قاعدين
notice
يتابعون
that
الأخبار
the
عن
least
طريق
satisfied
الوسائل
people
الخاصة
were the people who were
أو
following the
الإذاعات
news
الخاصة
based
والقنوات
on
الخاصة
private channels
عادة
and
معروف بأن
private
الإذاعات
stations.
الخاصة
It is
والقنوات
known that
الخاصة
private
مو دائما
stations and
تحرص
channels
على
do
التأكيد
not
من المعلومات
necessarily
وتنشرها ولكن تحرص
double
على
check
الضبط الصحفي
the source of
وبالتالي
information,
في
but
كثير
they
من
want
الأحيان
scoops.
تكون
And most
يعني
of the
مقاطع
time,
وتكون حتى
they
تقاريرها غير
have
موثقة
reports, they have
وبالتالي
actually
أنت اعتمدت على هذه
undocumented
التقارير بشكل
reports, and they
أساسي
rely
لنقل
on
معلومات عن
these
القضايا
reports
العاطفي
or
شيء
relying
أكيد
on
أنه
these
في ظل
reports.
انتشار مثل
Of
الرسائل اللي
course,
قبل شوي على
one
التليفون
would
أكيد راح يكون
be
مستوى الرضا أقل
less
وكذلك
satisfied
مستوى
in
الثقة
addition to less confident.
بعدين جمعت 30 إجراء قامت
After
به
that,
دولة
I
الكويت ما بين
brought
قوسين
together
وما بين المواجهة
30 measures
إجراء معين
between
كان مناسبة
regulations,
لاحترام
rules
التعافي
that were
والتعامل
adopted
مع
by the government of Kuwait during the pandemic
الواجهين
in order
جمعت
to deal with the
أو
migrant
30
laborers.
من هذه
So
الإجراءات
I had
عن
30 measures
المشاركين
taken
هل
into
تعتبر
account, and
هذا
I asked
الإجراء ضرورة
the
مركزية
participants,
أم
do you
عنصرية
consider
أم
this
انتهاك حقوق
measure
الإنسان أم هي
necessary,
غير منطقية بالنسبة
racist,
للأمن الوطني
human rights
بشكل
violation,
عام مع
and
أنه
threat
كان
to
يقام
national security? In
توفير
general,
عدالة
once again, there was no difference between the answers of the citizens and the experts. The great majority agreed in general that the measures were necessary and were logical, except for some measures that you can see in bold here. For instance, the thing that witnessed racism and human rights violations the most was the law prohibiting the renewal of visas for people older than 60. And as you know, this law is on the way to be cancelled. It will not be implemented for long. And the second thing that was important, having people who are violating the law leave the country without having to pay extra. And people said that this is not logical and is a threat to national security. I think people who answered are citizens, not expats. Why? Because in Kuwait we have a long history of silence on behalf of the government when it comes to dealing with people who violate the law. For generations, we have had people living in Kuwait illegally, but the government turned a blind eye. So, during the pandemic, when this is allowed and then they are allowed in or back in whenever they want, this would result in a negative response, and the measures would be considered a threat to national interest. Also, when it comes to this percentage, some people talked about racist behavior and also human rights violation. The biggest result or that drew my attention was the use of the employer of a number of employees without the knowledge of the ministry. So just imagine that a quarter of the participants say that this is necessity. So just imagine that the sample that we have agreed, or a quarter of the sample agreed, that it is necessary. In my mind, there are three justifications. Either people who did not understand the question correctly, and this is what I hope, or people would see that this is legal, the legal papers and lawful papers, although these measures humiliate the laborers because they cannot get their rights as their presence there is illegal, and this is how several human rights violations take place. So this is the trade of residencies. And also, I would like to mention some harsh reality. During my talk with citizens and expats, some of them said that since both parties agree and since the laborer understands that this is the situation, then it is not harmful and both parties would benefit. And in Kuwait, expats in particular and Arab expats, they understand that when they get to Kuwait, they can get uh, a lot because law enforcement is actually weak in Kuwait. So this thought process encourages even normal individuals to have these measures. We knew of an institution or someone that gets permits and uses the permits. This is actually an ethical and political and legal problem. So 60% of the participants said that confiscating the passport is a violation of human rights. In conclusion, last year we noticed that although the citizens and the expats were positive generally in their trends,
بعض
and
الإجراءات العديد من الممارسات الفعلية
many
لبعض أصحاب العمل
practices
لم
by
تلتزم
employers
بالقواعد الرافدة
did not
بأعتمدها القوانين الدولية
take
لصالح
the
الأفراد
rights of
المواطنين
expats
لأنها
into
تساعد
account.
على ضرورة العمل.
And
ثاني شيء
the
دستور الكويتي
second
لو
thing
نشوفه في مواضع
is that
كثيرة
the Constitution
ضمن
of Kuwait includes
يعني
several
تحفظ حقوق
articles
العاملين
that
مثل
preserve
يعني
the
النظام
rights
القانوني
of
نفسه
laborers,
يتضمن مراعاة
particularly
قواعد العدالة
when it comes
الاجتماعية
to social
وإراعاء حقوق
justice
العمال وأصحاب
and the
العمل
relationship
والمسؤوليات
between
الديمقراطية
the
الجديدة
employer
ممارسة
and
الإجراءات
employee,
الإنسانية
the
والاحتفاظ
landlord
بقوانين
and
الحقوق
the
والواجبات
tenants,
والاعتراف
and
بينهم بالجنس ونسب
the
اللغة والدين
lack of
وحقوق
discrimination
الشخصية
based
المدنية
on
ولا
religion,
يجب
race,
يعني
and
ممنوع
nationality.
من
So there's a set
الحيوان
of
التي تخل
articles
هذه
that
القواعد. الأمر
guarantee
الثالث
these
نشوف أن
rights.
المشكلة مو في
So
غياب
once again,
التشريعات اللي
we
تكفل
see
حق
that the
العمل
problem is
الآمن،
not an
ولكن
absence of
المشكلة في إنفاذ
legislation,
هذه
but the
القوانين
problem is
ومراقبة الالتزام
the
فيها على أرض
enforcement
الواقع،
of these
محاسبة
laws
المخالفين
and
مع
monitoring
العمل مع
the
المواطن
enforcement
وغيرهم
of the
ضمن
laws
تشريعات
and
قانونية
holding people
والأوضاع
accountable
الاقتصادية الاستثنائية
and
لإعادة
working on the harmony
إجراءات
between
الرافدة
these laws and the
بمراحل تقليص
international
الخسائر
standards
الاقتصادية
that
مع
would
ضمان
lead
حقوق
to
العمال
limiting economic
والحفاظ على مبدأ
losses
التضامن
and at the
الاجتماعي
same time
حفظا للحريات
preserve the rights
الفردية.
of the
ألف شكر على الوقت
professionals.
والإهتمام.
Thank you so much.
شكرا دكتورة ملك على هذا العرض وعلى هذه الدراسة.
I would like to thank you so much, Doctor,
نفتح
for this
هناك أي سؤال.
study. Uh, we now have some time for questions. Do you have any questions?
فقط بالنسبة للدكتور فهد،
A
يعني
question
لما أنت كنت
addressed to Dr. Fahd.
دراستك يعني
If you
واضح
allow me,
أنها
in your
كانت
study,
محدودة مثل ما
it
أشرت،
is
يعني في
clear
حدود
that it
الدراسة،
was
وأهم
limited when it comes
حد من حدود
to
الدراسة
the
هو المدة الزمنية اللي كانت منذ
actually
بداية شهر
aspect of the
3 إلى
timeline.
6
So
شهور تقريبا،
from
وهذا
3
أمر
to
يعني
6 months,
مميز أنها
and
تعرض
this
دراسة في حدود
is
زمنية
something special
وتشير
to have a
بكل
study
وضوح على
published
يعني اجتهادات
and
وسياسات
also
الحكومة في
talking
هذه
about
الفترة.
this
السؤال
duration
للدكتور
and the
فهد،
policies
شلون
of the government.
تقيم
The question
ما
is,
بعد هذه
how do
الفترة،
you evaluate
يعني بعد فترة
the
الدراسة
period that
بحكم
followed
بشكل
after
عام،
this study in
بحكم
general,
خبرتك، ولو عملت
based on
الدراسة
your expertise?
الآن
If
هل
you
ستخرج بنفس
carry out this
النتائج؟
study now, would you
هذا
have the
السؤال
same
للدكتور
results?
فهد.
This is a
دكتورة
question to
ملك،
Dr. Fahd.
هل
Dr.
تعتقدين
Malak,
يعني
do
بشكل عام
you think
احنا
in
لسنا
general
بحاجة إلى
we
عمالة وافدة
do not need
وأنها
expats
تشكل
or
ثقل
migrant
على
workers,
الدولة، أو بمعنى
and are
آخر
they a
خلينا نقول
burden
السؤال بهذه
in
الطريقة: أي
Kuwait?
نوع من
Or let me
العمالة
reformulate.
التي لا نريد؟
What kind of
تفضل
migrant
دكتور فهد.
laborers we do not want? Dr. Fahd, the question.
دكتور
You
فهد.
can answer the question now.
إن الدراسة محددة زمانيا ومكانيا
Yes.
واضح.
So, can you hear me? Yes, we can hear you.
فبالتالي احنا من يعني
So,
اشتغلنا على هذه الدراسة
we have worked
في
on
توجيه
this
يعني
study
في فترات الحظر الكلي والجزئي،
during the
لأن
total
يعني الإصابات
lockdown
كانت
and
في شهر
partial
فبراير.
lockdown. The
احنا بدينا نشتغل في شهر مارس
cases were in February. We started working in
محللين
March.
ومبينين للفعاليات
Reporters,
والمتابعين
analysts,
للأحداث اللي يشتغلون فيها الدولة
and
والكويتي
also people
والجميع
who were following up
وأجهزة الحكومة
and
والحكومية والقوى الفاعلة.
witnessing
طبعا
the
انتهينا فترة
acts in the
مراحل
state
الدراسة
of
خلينا
Kuwait
في نهاية
from
شهر
government
7
actors and
تعتبر
non-government
من
actors.
المراصد
We
العربية
presented
الأولى
the study
التي قامت بأخذ
in
الأبحاث
June,
وتناولها
and it
وفحص
was,
مسيرة
or in July,
العمليات
and it was
السياسات
one
الرافدة
of the
التي
first
قامت بها
studies
الدول صاحبة
examining
النجاح.
the
فكان
public
يعني
policies
نتيجة
of states.
يعني كانت
As
هي نتيجة
I have said,
يعني
it was
دراسة
the result
كيفية اعتمدت على منهج
of
التقارير
a
السنوية والتي تركز على موضوع
study
الدراسة ومنظومة
that
الثقافة،
relied
منها التساؤلات
on
ومن ثم الإجابات
questions
على التساؤلات
and
والإطروحات المطروحة في الجوانب
deducing
الصحيحة. الآن
answers
بتسألني
and
يعني
trying
بدأت
to
تقييم
answer the
الكويت
questions.
ما بعد
If you
هذه
ask
الفترة
me
ما بعد جون
about the period
2020
post
لو أخذنا
June
الآن أو مدى
2020
قدرة المنظومة
and
الصحية
how
بشكل
capable
عام كجانب
is
وظيفي أو
the
غير عملي
healthcare system
أسست
in
منظومة
general,
منظمة
and
التحليل والرصد، نشوف أن دولة
especially when
الكويت
it
هي من
comes to
أكثر الدول
analysis and
يعني
monitoring, we can
كمية
say
بعدد الوفيات
that
على In Kuwait, Kuwait is one of the countries that witnessed the least deaths or also cases. So since 1 month in Kuwait, we have no citizen or expat in ICUs and no deaths. So this means that all the measures adopted by the state from the top of the structure were efficient, led to the protection of the life of people, respond were responsive. They used, mobilized all professionals in the healthcare sector, and these efforts were commended by the Kuwaiti citizens, but not only Kuwaiti citizens, but also the WHO and its director, and also the teams that visited Kuwait to examine Kuwait's strategy, and Kuwait achieved great results when it comes to the response vis-a-vis this unprecedented pandemic with unprecedented repercussions politically and at the economic and social levels. In my opinion, Kuwait succeeded in this test. It evaluated its policies. It was uh, experience actually in Kuwait. It was something unprecedented at an entirely different level. The Kuwait succeeded when it comes to the use of technologies and how to run the country, in addition to preserving, from a security and military perspective, the expats. The country succeeded in building quarantine facilities and also got the vaccines. Also, I disagree with Dr. Malak when it comes to racism in Kuwait. I do not think there was any racist practices. The citizens and expats were dealt with uh, equally, and when it comes to providing vaccine, when it comes to providing food and beverage, there was no discrimination. The Indian Indian expats, also Egyptian expats, were actually positively reacting. Also, the government provided the opportunity for them to migrate, although the country was closed, and the government supported people in need. So, from my opinion, as a researcher in the field of COVID and also as an analyst of the rules and regulations and laws and legislations and decrees in Kuwait, so since the beginning of our study from March to June and afterwards, I think that the state of Kuwait was one of the few countries that were capable of testing its resources and succeeding in controlling this pandemic and succeeding. Thank you. Dr. Malak, the floor is yours.
آه، بداية قبل لا أرد على
Before answering the
سؤال
question of
يعقوب الكندري
Dr.
دكتور
Yacoub
فهد،
Al-Kandari, I would
أنا
like
معك
to
100% في
say
السؤال
to
ده.
Dr. Fahd, I
أتفق
am
بأن الدراسة المصرية
100%
وأنا أقول لك أن الدراسة
with
المصرية
you. The study
يمكن قد
proved
يكون
that there was no racism, and I can say that there was no
التظاهر
racist
أو
behavior.
التظاهر
And maybe
الإعلامية خاصة
some
برفض
private media
وجود
outlets
مثل
actually spread
هذه
these
المشكلة،
allegations,
وأن كان في
and
يعني اللي أرد عليه كان في بعض
there were
بعض التلميحات وكان
some
في بعض المشاهدات،
people who
ولكنها لا
alluded,
تعتبر
or there
مثل
were
ما
some
نسميها مثلا
problems, but
العنصرية
we cannot talk
التقليدية.
about
وبالعكس
the problem of racism in Kuwait. So, on the contrary, I agree with you. The study agrees with what you just said. The participants actually proved that there was no discrimination between expats and citizens. So, all the measures were logical, legal, and equally adopted. So I would like to apologize if I misspoke or if I wasn't clear enough in my presentation. But what I meant is completely different, which is the fact that Kuwait, government of Kuwait, actually dealt with these issues as per the international standards and also laws, except for some individual cases. Uh, Answering Dr. Yacoub al-Kandari's question, Kuwait will always need migrant workers. We cannot do away with migrant workers, but Kuwait does not need informal or illegal workers, misplaced, and there is no real need for these numbers. And I think some deals could be political, could be economic, to draw the large numbers of migrant workers that would affect the social stability in the country. So the new technologies are uh, important. And answering your question, I think we need skillful uh, workers or professionals, and also at the same time we need laborers in the fields of industrial fields and the construction field, where usually GCC citizens do not work. So we still need migrant workers, in addition to the fact that this allows, or this would allow opportunities for skilled workers. So we need different forms of migrant workers in specific sectors in Kuwait, uh, and the government needs to deal with the situation legally and taking into account human rights. So we do not need informal and illegal workers that the different Kuwaiti sectors do not need. So migrant workers are part of the societies and the Gulf. Thank you, doctor. I agree with you both. I wanted to stress an important point. The social media played an important role when it comes to instigating and spreading rumors, and social media actually spread bad news, not positive news usually. And Dr. Malak, I encourage you. It's actually an important study. I encourage you to develop this study, and this presentation would be the pillar for a new, more expansive study that could be published. And maybe if you have a bigger sample, you can compare migrants, expats to citizens, and this could be the basis of a very important study, particularly when it comes to the social construct in Kuwait. One last question.
في ميكروفون اذا سمحتي، لو سمحت معتز، التليفون.
Thank you, Dr. Fahd, Dr. Malak, for your participation and for this rich intervention. Dr. Malak, I will address my question to you. The Gulf countries, indeed, in comparison with the rest of the world, have been successful in staving off the spread of the virus. The vaccination rollout has been expedited, has been effective, But still, the migrant workers issue is paramount. We ought to focus on it. Why the Gulf countries have decided to lay off expatriates rather than providing social protection, especially when you have the wealth to cover such protective measures. Thank you. Dr. Malak.
شكرا عزيزي على سؤالك جدا
Thank you. Your question is very important. Dispensing with migrant workers took place in a narrow kind of scope. Most of the layoffs took place, as I have said, took place when a migrant worker violated the rules, or those who worked in the black market, or those who had no accommodation, no security in the jobs, and so on and so forth. The government has provided vaccinations for all, but still illegal migrants were hesitant to come to the centers to take the jab. So some groups indeed were dismissed with or dispensed with, and it was long due. We ought to have taken these measures following the violations of the rules of the Kuwaiti rules. And as I said, most of them were not included in the statistics, and it was difficult to deal with them. And when we followed a precautionary investigative mechanisms, we understood that these were illegal, and some of them had no birth certificates. We didn't know how they ended up in Kuwait, and how they received medication, or how they received health care if they fall ill, and so on and so forth, and their children. So the Gulf countries will never dispense with the expatriates or the migrant workers, but some of them were expelled because they worked in the domain of the SMEs, and some SMEs closed their business, and they laid off their employees. So Kuwait has launched a campaign entitled Travel Safely. Those who have violated the rules had the opportunity to leave the country. They can be repatriated legally to their country of origin. So again, excluding these people was nothing to do with the policy that we have adopted. Those who were at the top of the work were not dismissed. Thank you. At the end of this session, I would like to remind you that there is a subsequent session that will start in 4:15, 16:15. Thank you, and have a good day.